everyone and welcome to Wellness Mantra. I'm your host Himani. Did you know that diabetes contributes to 60 to 70% of end-stage kidney failure? Isn't that quite disturbing? Diabetes mellitus, usually called diabetes, is a disease where your blood sugar is too high because your body does not make or use insulin the way it should. The excessive sugar stays in your blood and can cause kidney damage. Now, when your kidneys are damaged, they cannot filter blood like they should, which can cause wastes to build up in your body. Kidney damage caused by diabetes usually occurs slowly over many years. So, let me introduce you to Dr. Srinivas Subramanian, a specialist in renal medicine with over 10 years of experience, to share with us how we can protect our kidneys and prevent or delay kidney damage. Hello doctor, welcome to Wellness Mantra.
Pleasure to be here. Thanks for having me.
Well doctor, to begin this discussion, I want to ask you, is it a fact that a person suffering from diabetes is sure to experience kidney damage?
Well, if the patient takes care to control the sugars, stick to the diet, take the necessary medications,
right,
then the probability of suffering kidney damage is significantly minimized. Those patients who have either managed to reverse the diabetes or have controlled the sugars are under very low likelihood to suffer kidney damage.
Right, but then how does one identify? What are the earliest signs of a kidney disease in patients with diabetes?
Most patients with early kidney disease do not experience any symptom. In diabetic patients, especially when the sugars are high, there is an increase in urine production, a term that we medically call as polyuria, because the kidney filters out the excess urine. And over time, what happens is there is an appearance of a small amount of a protein called as albumin in the urine. And this is one of the earlier signs of kidney damage. Over time, the amount of protein in the urine goes up. We call that as proteinuria. And this is followed by a reduction in kidney function.
And you can only find this out through a urine test or a blood test?
Yes, the microalbuminuria is detected by testing a specimen of urine, preferably taken in the morning. And the reduction in kidney function is detected by a blood test, by measuring a chemical called as creatinine.
So having said that, doctor, how can someone who has diabetes keep their kidneys healthy?
Well, the most important thing is to keep the sugars under control.
Yeah.
In addition, there are specific medications that protect the kidney in the long run. Such medications are called ARBs, angiotensin receptor blockers, or ACE inhibitors. And a lot of diabetic patients also have high blood pressure, so it's important to maintain the blood pressure at a healthy range in all patients, but especially those who are diabetics.
Right.
That and avoidance of medications that have the potential to harm the kidneys. So with these measures, the patients can ensure the well-being of the kidney, and also frequently visiting the doctor for periodic checkups.
So this is about sugar levels or diabetes. What other factors, according to you, can lead to a kidney damage?
There are 4 large classes of diseases of the kidney. The commonest cause of kidney failure in Singapore is diabetes.
Right.
And in addition to that, you have certain immune conditions of the kidney. The commonest of that is called IgA nephropathy. Then hypertension is another risk factor for kidney disease. And then inherited diseases of kidneys, such as polycystic kidney disease. So these are the common causes of kidney disease. Besides these, the other things that we frequently see in practice are patients who suffered an acute kidney injury but did not recover from that episode fully. So what we call as acute kidney injury with subtotal recovery. And in addition, side effects from medications, especially certain kinds of pain medications, certain antibiotics, these can cause kidney damage as well.
Is cardiovascular disease and kidney disease, are they related?
Yes, they have what we call as a mutual relationship. They are linked by one of the 2 mechanisms. The first one being both cardiovascular disease and kidney disease share risk factors. So just as diabetes is a risk factor for kidney disease, hypertension is a risk factor for kidney disease, these are risk factors for cardiac disease as well. So they have this relationship where they have overlapping risk factors. The second relationship is a cause and effect. Someone with kidney disease has an independent increase in risk of developing cardiovascular disease, and vice versa, what we call as cardiorenal syndrome. So someone with certain forms of cardiac disease, heart disease, can result in damage to the kidneys as well. So they are both linked causally and with each other.
Doctor, now you are known to have a very healthy lifestyle. You're very passionate about fitness. What is your mantra that you would want to give our viewers to lead a healthy lifestyle?
Yes, if there is one thing that I would share about what I do for fitness is consistency. Whatever you do, it could be tennis, it could be walking, swimming, whatever you do for fitness, make sure you do it consistently over time to have long-standing benefits over time. And mix it up, so do aerobic fitness, strength training, flexibility, and so you have to work on different dimensions of fitness.
So, well, we have it from the doc himself. Consistency is key. Thank you so much, doctor, for talking to us.
It's been a pleasure. Thank you.